And this usually utilizes energy, and ATP is the one that supplies it. So we have many coenzymes, cofactors, and prosthetic groups. Okay, and these coenzymes are usually taken from your water-soluble B vitamins, the complex B vitamins. So we have nicotinamide from niacin, riboflavin as a source for flavin enzymes, and then we have pantothenic acid for coenzyme A, and then we have your thiamine pyrophosphate from thiamine, which is vitamin B2. No, vitamin B1 is thiamine, B2 is riboflavin. And then you have cobamide coenzymes, cobalamin. And then we have some pyridoxine coenzymes, pyridoxal phosphate, vitamin B6, and the cobalamin, your vitamin B12. And there are still others like biotin, folic acid. These belongs to the B complex family, and they are usually made into coenzymes. This is the structure of your NAD and NADP. So what's the work of the coenzymes? They serve as substrate shuttles. They ask as substrate shuttles. So catalysis occurs at the catalytic site. Now, I do not want to use that active site because there are many active sites in the enzyme. There is active site for control, but it is not the catalytic site. So it should be catalysis occurs at catalytic site. The adjective active site is much more than simply so I always use catalytic site. Enzymes, multiple mechanisms. So we have catalysis by proximity, acid-base catalysis, catalysis by strain, covalent catalysis. Okay, we have two theories. The lock and key theory, and the other one is Koslan's theory. The lock and key theory, just from the word, the lock needs to have the right key. And if you do not have the right key, it does not open the lock. So that's what it is. So this lock and key theory tells us that the shape of the substrate, should be also similar to the shape of the catalytic site. Otherwise, there won't be any binding. That is the lock and key theory by Fischer. The other one is Koslan's theory, which says that it debunks the lock and key theory because it says that there are substrates that do not look like, or does not have the same appearance as the catalytic site of the enzyme. But when the substrate comes near, the shape of the catalytic site changes to accommodate the substrate. That is Koslan's theory, or that is the induced fit theory. Induced fit theory of Koslan. Why not? It's just only to show how this is, the binding, so on. No? So what is meant by this? Catalytic residues are highly conserved. It means residues, when you say residues, it usually means amino acid in the polypeptide chain. So when we say highly conserved, it means that the same enzyme has the same sequence of amino acid, or between two different enzymes, the catalytic site are more or less similar, are highly conserved. So the catalytic residues, or the amino acids that are found in the catalytic site. So much so that because serine is very, very important, because of its OH, a lot of proteinases, so enzymes that act on protein, have a serine residue or several serine residue on the catalytic site, and we call such proteinases as serine protease. Serine protease, which means that in the catalytic site you have serine there, which is very, very important. So isozymes are distinct enzymes forms that catalyze the same reaction. So these isozymes, they are different structurally. Its composition, physical composition are different, but they catalyze the same reaction. Example, we have two enzymes that phosphorylate glucose, then adds a phosphate to glucose. Now, two important isozymes in the phosphorylation of glucose are glucokinase and hexokinase. Now, glucokinase has a high Km, and hexokinase has a low Km. So what does that mean? It means that if an enzyme has a high Km, it requires a large amount of substrate before it can react. This is an opposite to an enzyme with a low Km, meaning it acts even with a very small amount of substrate. And they are located, these isozymes are located in different tissues. So much so that these isozymes are also used as a diagnostic test for what particular organ is being diseased or has a problem. So Glucokinase and hexokinase performs the same reaction, but they are different according to their KM. Glucokinase is found in the liver. Hexokinase are found in other tissues, peripheral tissues, other than the liver. Now we know that after digestion of the food that we eat, all of those digested absorbed materials goes to the liver first. So you have the enzyme there, glucokinase, which has the IKM. So it takes a large amount of substrate before that glucokinase can phosphorylate the liver. However, when the amount of that glucose has come down to normal, your glucokinase does not work anymore. And so the glucose that has not been phosphorylated goes to the other tissues, not only in the liver. Otherwise, every glucose will go to the liver. Now, the hexokinase and other tissues on the peripheral tissues are happy with even a small amount of glucose. They can do its work. So it can phosphorylate the glucose even at very, very low glucose. So that fits their purpose. They are located on the peripheral tissues. Otherwise, if the hexokinase was in the liver, all of the glucose will be in the liver. It will not go to other places. Okay? So you can just now imagine the logic of your creator. If we just made a mistake on putting hexokinase in the liver, then all that glucose will be in the liver. You see? Now, catalytic activity of enzymes facilitates their detection. So, your isozymes are located in different areas or different cells. Now, if you do enzyme assay on the blood and you find hexokinase in the blood plasma, then you do not think of the liver because hexokinase is found only on the peripheral or other organs except the liver. So you can just right away know where it is. So that is how isozymes are detected. Like for example, LDH has 5 isozymes. Lactate dehydrogenase, they have 5 isozymes. LDH1, LDH2, LDH3 up to 5. Then you have creatine kinase, CK1, CK2, CK3. Now the medtechs here knows about this as some of the nurses know also this. Now, many enzymes may be assayed by coupling to dehydrogenases because it is easier to detect the presence of NAD or NADP, NADP or NAD. So they usually link this with a dehydrogenase. Like for example, you want to assay your hexokinase, they use dehydrogenase there because what you can assay here is not the amount of hexokinase, but the amount of products. Now you cannot assess this ADP as the product there, but you can assess NADPH or NADH. So this is the one that that shows in their machine. It is not this one. So they always equate that the amount of product formed would be similar to the amount of hexokinase in action. So many enzymes may be used to diagnose. Like for example, ALT or alanine aminotransferase is diagnostic for viral hepatitis. Amylase for acute pancreatitis. Ceruloplasmin, Wilson's disease. Creatine kinase muscle disorder. Gamma glutathione transferase, various liver diseases. LDH5, liver diseases. Lactate dehydrogenase 5. Lipase, acute pancreatitis. Glucocerebrosidase, Gaucher's disease. Alkaline phosphatase, bone disorders. See? So analysis of serum enzymes following tissue injury. So you will be asking, how come that an enzyme goes into the blood? Now in the blood plasma, there are two kinds of enzymes. One is the resident enzyme, or enzymes that are always in the blood, like for example, enzymes for blood clotting. So they are always there. But non-resident enzymes, so they are not supposed to be there. So how come they are there? How come they are there? Now, you should always remember that every time a tissue is destroyed, all its contents goes into the extracellular fluid. And the extracellular fluid is drained by the lymphatics. And the lymphatics joins with the general circulation and the left subclavian vein. So this is about near your clavicle, beneath your clavicle, left side. So they are not supposed to be there, but how come they are there? So when you are able to detect that, then you know which tissue is injured. Like for example, if you detect creatine kinase, no. Let's just say a lipase. Okay, a lipase. You take lipase in the blood plasma. This is acute pancreatitis because lipase is not supposed to be there in the blood. So, portion of your pancreas has been destroyed. Its contents goes into the extracellular fluid. From the extracellular fluid, drained by the lymphatics join the general circulation of the left. So it is there. Okay. So you can clinch the diagnosis through enzyme assay. Following tissue injury. Internet is gone, is sa ilan na dito. Hangin man. Are your connections okay there?
Yes po, Doc.
Yes, Doc.
Yes, Doc.
Yes, Doc.
All right. So yeah, like example, plasma troponin. So what does this mean? No? Plasma troponin. You know that troponin is related, no, to your cardiac muscle and the smooth muscles. Diba? Whenever you find troponin, and this is very, very good. This has been discussed by Dr. Mabulaw. Troponin is a very good determinant of your cardiac muscle integrity. So troponin level rises for 2 to 6 hours after an MI. 2 to 6 hours after an MI. So if you catch the patient within that 2 to 6 hours, then you have a high. And it remains elevated for a week. No? Diba? So that is the use of those what we call enzyme assay. All right, so additional uses of enzymes, so they are all there. Clinical laboratory to determine presence or concentration of critical metabolites employed in increasing frequency for treatment of injury and disease, like your plasminogen or streptokinase to dissolve the clots, trypsin for the treatment of cystic fibrosis, intravenous infusion of recombinant glycosylases can be used to treat lysosomal storage disorders. Enzymes facilitate diagnosis of genetic and infectious diseases. And this one now, the polymerase chain reaction, your RT-PCR, reverse transcriptase polymerase chain reaction. Polymerase chain reaction is used to increase the amount of genetic material so that you can do the testing. So you make several copies of that particular genetic material, and that is the polymerase chain reaction. That's why the RT polymerase test is takes a long time because you have to do duplication of the genetic material of the virus, or coronavirus, so that you can do testing. Because if you have only one there, it's very hard, no, to have a result. So you make several copies of the same genetic material. Okay. Recombinant DNA provides an important tool for studying enzymes. So we'll have a very good discussion of this recombinant processes or recombinant DNA. We take up your nucleic acids. Okay, a new form of enzymes which changed the definition of enzymes is the discovery of enzymes that are not protein. And these are your ribozymes. Your RNA are enzymes itself, especially the ribosomes. Ribosomal RNA. So here is the ribosome, the ultimate ribosome. Sunod. Kinetics of enzymes. We'll just go directly to Km and we'll go to Km and Vmax right away. By the way, factors affecting rate of enzyme reaction. Oh, you know that already. This is also important. It says collision theory, meaning if your substrate and your enzyme were not together, they cannot any enzymatic reaction. So they have what we call a collision theory. The more substrate, the better, so that you can create more collision with the substrate and enzymes. Raising the temperature increases also the enzymatic reaction by increasing the kinetic energy of the molecules. So the more disturbed the molecules are, they move around so much so that there will be collision with the enzyme. Now it says here that energy barrier, this is the energy barrier. Well, the enzyme is just only reducing or lowering the energy barrier. That is it, so that reaction can occur. Okay, another factor is reactant concentration. The more reactants, the better, for more collision with your enzymes. Now, always remember that enzymes do not affect the equilibrium constant. Equilibrium constant. It says enzymes lower activation energy barrier. It lowers the activation, or it lowers the energy barrier. Okay. temperature, hydrogen ion concentration. So that means the pH also is very, very effective. So much so that enzymes has what we call optimum temperature, or the temperature that they are uh, working well. Like for example, our body has 37 degrees centigrade. So enzymes there are supposed to work well at 37 degrees centigrade. However, when the temperature goes higher, then the enzymes become more agitated. Just like what happens when you have a high fever, you have hallucinations. Diba? You have hallucinations. You will hallucinate. While you are there in your deathbed, I'm sorry, in your bed, lying down, sick, then you are at high temperature, you can see your grandmother or grandfather who have died a long time ago, and they are trying to ask you to come with them. No? That is the effect of temperature because the enzymes are agitated. Also, as the molecules are also agitated, so that there will be more enzymatic reactions. Now, the pH as well. Our pH is usually our blood plasma is 7.4, but other areas of our body have different pHs. Like for example, the stomach has a pH of acidic pH, while your intestines have a high pH, alkaline pH. Okay? And the enzymes that are there works well at that particular pH. Like the pepsin in your stomach works well at a very low pH. So more acidic, more hydrochloric acid, the better for the pepsin. However, enzymes like your pancreatic enzymes works well at a higher pH, pH 10, pH 11, and they're very happy working at that pHs. So we call that optimum pH, where the pH, the right kind of pH for the enzyme. So it's just the same as your optimum temperature, as the temperature of the body, of course. While there is what we call temperature coefficient or Q10, which tells us that for every 10-degree rise of temperature, there is a doubling of reaction. 10-degree rise. So from 0 to 10, there's a doubling of reaction. 10 to 20, there's a doubling of reaction. 20 to 30, there's a doubling of reaction. However, when it goes higher than 40, then there is slower reaction because the optimum pH is around 37. Okay? All right. So here we see our Km and Vmax. So when we say Vmax is maximum velocity, and we say Km is the amount of substrate that brings about half maximal velocity. Okay, that's all you have to remember. Km and Vmax. Okay. Now here, this is already Vmax. All of this already occupied. The enzymes here are occupied by the substrates. So the Michaelis-Menten equation. Okay, so we have here initial velocity is equals to Vmax times concentration of S all over Km plus concentration of S. That is your Michaelis-Menten equation. And this is your Lineweaver-Burke plot. It tells you that you have a straight line because it's very hard to have to, you know, to measure when you have a curved line. You have a curve like this, like your hemoglobin, especially it is sigmoidal like that, no? So we have a Lineweaver-Burke utilizing that, that Michaelis-Menten equation, so that you can have an equation for straight line. The straight line equation, Ax plus B, di ba? Still remember your mathematics? This is how it is. This is how it was from Michaelis-Menten, and then it goes to this, where you have a straight line. So you call this the Lineweaver-Burke plot. All right, so if you examine this, this is 0. This is your substrate. This is your velocity of reaction. So anything beyond towards the left is negative, towards the right is positive. Okay? So this is your Vmax here. This is your Km. So nearer to 0, the higher the concentration. Okay? Farther from 0, the lower the concentration. The same thing as here. Now towards the right, the nearer to 0, no, low amount of substrate. If you go higher towards the right, becomes higher. And so also this one, because that's 1 over V, no? So the nearer, this would be lower or higher. Okay. Never mind that Hill equation. Hill. Competitive inhibitors. So we look at inhibitors. We have competitive. Competitive inhibitors acts on the catalytic side. So these competitive inhibitors, you have the inhibitor looks like the substrate. So they looks like the substrate, so they can be mistaken by the enzyme and so bind to the enzyme. No? And since it is not the correct substrate, nothing happens. And so that inhibitor stays with the enzyme and that enzyme becomes useless because no substrate can bind to it anymore. Because when the inhibitor binds to the substrate, to the catalytic side, nothing happens. So it stays there. A good example of that is succinate and malonate. If you look at malonic acid and succinic acid, they look like the same, but they have your malonic acid has fewer number of carbons compared to your succinic acid, which is 4. Malonic acid is only 3. So there is no way that two hydrogens can be removed. So that is the inhibitor of your succinate dehydrogenase, malonic acid or malonate. Now here you are. You can see that succinate has 4 carbons. 1, 2, 3, 4. So you remove this hydrogen and this hydrogen, and you have fumarate as a result. But with malonate, you do not have this. There are only 3 carbons. So there is no way that you can create a double bond. Because once you create a double bond, the 2 carbons will be having 5 attachment or 5 ligands, in which your carbon has only 4. Now, the other type of competitor is the one that affects on the other sites, active sites, or allosteric inhibitor, in which once this inhibitor binds to that allosteric site or other active site, it changes the configuration of the catalytic site so that the substrate cannot bind anymore. And that is allosteric inhibitors. Allosteric inhibitors binds to other sites, not the catalytic site. But competitive inhibitors binds to the catalytic site, similar to the substrate. So as you see here, you can have the Lineweaver-Burke plot with an inhibitor here and no inhibitor. Okay? Simple non-competitive inhibitors lower Vmax, but does not affect the Km. While competitive inhibitors affects the Km but does not affect the Vmax. That's the difference between the two. As you can see it here, all right, non-competitive, they have the same Km but different Vmax. Different Vmax. The same inhibitor, or the same Km. This one, the same Vmax, but different Km. So this is inhibitor, no? 50% inhibition, IC50. Oh, so you have inhibitor concentration 50%. When it inhibits 50%, that's a very effective inhibitor. And higher, no? Tightly bound inhibitors. So there are some inhibitors that bind tightly to the enzymes. And instead of an AS complex, enzyme and substrate complex, we have an AI complex, enzyme inhibitor complex. Reversible inhibitors are called poison inhibitors. So they stay there forever, and this does not or destroys already the enzyme, because the enzymes cannot do its work, normal work anymore. So some of the drugs that we are taking acts as enzyme inhibitors. Destroy or impair the growth or invasiveness, development of invading pathogens, stimulate the endogenous defense mechanism, halt or impede aberrant molecular processes triggered by genetic environment. Like now in our coronavirus, there are some pharmaceutical companies, aside from the vaccine that they are trying to create, they are also trying to find out some mechanism by which they can prevent the replication of the virus, so that the virus cannot replicate anymore. You know, the virus invades a normal cell and utilize the mechanism of the cell to produce the proteins that the virus needs. So they are just like riding on already a mechanism that is there by the cell, normal cell, and then they just come over and take over the control of the mechanism to produce the necessary proteins that they need. And that's how the virus works. So they are trying to impair the growth or development of the invading virus. That's what some pharmaceutical companies are doing. Okay? Most drugs are metabolized in vivo. All right. Enzyme regulation. You know what is this? This is the metabolic flow. No? This is the cell. This is so simple. That's what my grandchild says. Symbolize. No? Is a simple illustration of a cell. Nutrients come in, waste products goes out. But before the waste products goes out, there are a lot of reactions occurring, utilizing high energy phosphate. That's the squiggle there. The squiggle with a P, that means high energy phosphate. That energy phosphate comes from ATP. So ATP is used here. ATP is generated here. So this reaction generates ATP, while this reaction utilizes ATP. So this tells us this is anabolic, this is catabolic. Anabolic, building a large molecules out of small molecules. Small molecule nutrients, smaller molecules are being utilized to form ATP to be utilized for synthetic purposes. Compartmentation of enzymes also regulates the activity of enzyme. So enzymes for the liver are there in the liver. They are not working anywhere else. So enzymes from the pancreas work is in the small intestine. It does not go to other parts. No? Rate-limiting enzymes as preferred targets for regulatory control. Rate-limiting enzymes are usually enzymes that are found early in the metabolic pathway. Usually is found in the first or second enzymatic reactions where you have regulatory control. It's either the control is product inhibition, or when you have so much products already formed and the product itself is the one that inhibits the activity of the enzyme. Product inhibition. So another way is to regulate the enzyme quantity of enzymes. No? So that is again brought about by several controls. And one of the effective control is product inhibition. And then enzymes are continuously synthesized and degraded. Because enzymes activity, they work so much that it might be that there might be some already parts that are worn out or amino acids that are worn out. And so they have to be degraded, as well as they have to be continuously synthesized. So amino acids synthesized into enzyme and enzymes degraded back into amino acids. So there is a continuous synthesis and degradation. So one way is to control enzyme synthesis, and the other is to control enzyme degradation. If you want more enzymes, so you stimulate the production of enzymes. And if you want to diminish the enzymes, so you have to control or increase the degradation of enzymes so that the enzymes will not be high in concentration. So it's just a matter of synthesis and degradation control. So this is our allosteric effects. We mentioned this already. No? You know what it is? Now, if all of the products are A, B, C, D, all the products of this metabolic pathway are increased, they do not only stop this, but this stop here. That's how it is. Concentrated efforts. Oh, that's how it is. Look at that. It stops directly here. So this is an allosteric enzyme. There. Formerly, if this is not so much that can affect the activity of the cell, then this product will only affect that one. This product will only affect this. This product will only affect that one. This one only here. No? But if they, all of them, all of a sudden, they have high concentration already, then concentrated efforts is done in here. All right, we ran out of time already. We're almost. Are you still there?
Yes, Doc.
Yes, Doc.
Yes, Doc.
Doc.
Yes, Doc.
Yes.
We still continue. We have. What time is it now?
5:40 po, Doc.
We still have how many minutes?
About 20 minutes, Doc.
Okay, so we'll continue. So going back again. So So we have here, look at this. Now enzymes can be controlled by phosphorylation. Some enzymes, when they are phosphorylated, they become active. Some enzymes, when they are phosphorylated, they become inactive. As you can see it here, you have the enzyme, activity state, low and high. Acetyl-CoA carboxylase with a phosphate is low in activity. But without the phosphate, it's high activity. Now compare it here. Glycogen phosphorylase is inactive when there is no phosphate. But when it is phosphorylated, it becomes active, high. No? So this shows that phosphorylation is some kind of control which we call, there's a saying, shooting two birds with one stone. No? Two birds with one stone. Now, for example, glycogen synthase and you have your glycogen phosphorylase. They are opposite because the glycogen synthase produces glycogen from glucose, while your glycogen phosphorylase degrades glycogen back to glucose. So they are opposite in activity. No, they are opposite. So how to control them is phosphorylation. If you can see, if the glycogen is phosphorylated, glycogen synthase is phosphorylated, it inhibits its activity low. Okay. Now, phosphorylase without a phosphate, its activity is low. Compared to that, no? Okay. With a phosphate, low. Without a phosphate, low. No? Two opposite enzymes. Now, if this is not controlled this way, where glycogen synthase, the glucose coming from in the blood, coming from the absorbed glucose from digestion, goes to the liver, goes into the blood, and then if there is a high supply, then the glycogen is being, the glucose is being transformed by the glycogen synthase into glycogen, stored it in the liver. However, when the glucose is low in the blood, then this amount of glycogen stored in the liver has to be degraded to become glucose again to supply the low amount of glucose in the blood. And this is the work of the glycogen phosphorylase. So they are both found in the liver cell. So if they are acting on the same time, then it becomes a useless cycle. So while glycogen is being formed by the glycogen synthase, the glycogen phosphorylase should stop degrading the glycogen. Okay? So a very good control is just phosphorylation. When you phosphorylate glycogen synthase, it becomes inactive, low activity. However, if you are going to phosphorylate phosphorylase, glycogen phosphorylase, there it becomes active, high activity. No? The opposite is without the phosphate, phosphorylase has low activity or no work at all. While glycogen synthase without the phosphate becomes high in activity. You see that? So it's phosphate. Phosphorylation is one of the best control. And you have several of those, not only glycogen phosphorylase and glycogen synthase. All of these enzymes here are controlled by phosphorylation and dephosphorylation. Individual regulatory events, never mind that. Oh. Tapos. So protein phosphorylation is extremely versatile. Very, very good control on the enzyme activity. This also regulates the metabolites to pass through acetylation and okay. Protein acetylation of, so that becomes activation of substrate by acetyl-CoA. Now, if fatty acids are being used for generating ATP, that fatty acid has to be acted upon by acetyl-CoA, so long-chain fatty acid. Acyl means acid. Long-chain fatty acids are acted upon by acetyl-CoA, so that long-chain fatty acid becomes acyl-CoA. So if this is folic acid, once acted upon by acetyl-CoA, it becomes now oleal-CoA. If it is stearic acid, it becomes steroyl-CoA. And that is the first step in utilizing fatty acids to generate ATP in metabolic pathway known as beta oxidation. So from the word beta, so it's the beta carbon of the fatty acid that is oxidized and is cut and becomes so that is how it is, no? Your long chain fatty acids. This is covalent phosphorylation, which I mentioned earlier, that phosphorylation of enzymes, it's a very good control. Then the question would be, at what particular amino acid does phosphorylation occur? It occurs on amino acids that has an OH. An OH, like serine, OH here. So this is phosphorylated, utilizing ATP, and you have now the phosphate here. So this enzyme is now phosphorylated. Now we do not know whether this becomes active or becomes inactive. It all depends on the enzyme. Just like when I said about glycogen synthase and your glycogen phosphorylase. And removing of the phosphate here is brought about by the enzyme phosphatase, which cleaves that phosphate and it goes back to its original. So that's what we call covalent modification, which usually regulate enzyme by phosphorylation and dephosphorylation of the serine residue. Of course, you have two other enzymes, two other amino acids that contains an OH, and that is threonine and of course tyrosine. But most of the time, it is always serine that is present in the catalytic site. That's why they are called serine enzymes. And if they act on protein, we call them serine proteases. Okay? This one is having a large polypeptide which is cut into several places so that to form an active enzyme or an active molecule. Sequence of proteolytic meaning cutting. You have to cut from a long polypeptide chain. So there are several enzymes that are involved here. This enzyme here, this enzyme, this enzyme, this enzyme. You see, this enzyme cuts the peptide linkage between the 15th and 16th amino acid. So it cuts here. Then another enzyme comes in to cut 13 and 14. So you have here the 14 and 15 here. They are not used. This is the one that becomes active. There. So here, this is cut 146 and 147. Then another one which cuts in before 149. And so you have here 147 or 148. So there are three segments now. There are three segments. These segments with 1 to 13 amino acids, and this one 16 to 146 amino acid. The number here does not mean the number of amino acids, no? This is the number of the place where the amino acid is. Because this has been cut. And then you are sure that this particular amino acid here is a cysteine because it creates a disulfide bond with another cysteine residue here and another cysteine here and a cysteine on this other segment. And so they are joined together. So this is the active enzyme. So this is the inactive known as the pro-enzyme. And this one now is the active enzyme. That's the one there. Proteases may be secreted as catalytically inactive proteins or proenzymes. They have to be activated at the site where they will act, not before. Because that particular portion where they were created or they were synthesized may not have a protection when this enzyme becomes active. So it's going to eat up the cells there. So they are secreted as proenzymes. And they are only activated at the site where they are needed. Because probably that site there has a protection against the enzyme. So they are only working on, like for example, pancreatic enzymes. The pancreatic enzymes, once they are synthesized within the pancreas, they are secreted as proenzyme into the intestine. Because the intestine has a protection against the active enzyme. So they cannot be digested. While if these enzymes were activated within the pancreas itself, where it is created or synthesized, then they are going to eat up the pancreas. And you will have a pancreatitis, acute pancreatitis. Proenzymes facilitate the rapid mobilization of our activity and response to physiologic demand. So when they are in transit, they are not active. But once they are there in the area, then they are activated. So activation of pro-chymotrypsin requires selective proteolysis. Okay, there are enzymes that are located in some places where you'll wonder why it is found here. Like for example, pepsin is a stomach enzyme which acts on protein. But why do you have pepsin in the lungs? No? It is used to destroy whatever organism that we inhale. And the lungs is protected from it by mucin. Okay? However, when you smoke, formation of mucin in the lungs diminishes. And you know what happens to smokers? They destroy their lungs. Diba? Activation of pro requires selective proteolysis. That's the one that I've shown you. But there are enzymes that cut at specific places of the polypeptide chain in order that it will be activated. And not only enzymes are being activated like that. Also your hormones that are protein in nature, they're activated similarly, like your insulin is being activated by cutting portions of the polypeptide chain. Okay? Oy, wala naman tayo oras. Nanawag naman. How is the weather in Tacloban?
Rainy, sir.
It's rainy, Doc.
Raining?
Yes, Doc.
There is no rain. There is no wind. Only rain. Huh?
Sometimes it gets windy, Doc.
So, you are not affected by Typhoon Ulysses? You are not affected by Typhoon Ulysses there? Wala.
Sure, Doc.
Okay. So, we're not able to act on others, but the one that I just more than enough to let you pass.
Thank you, Doc.
Thank you so
Doc.
much, Doc.
Thank you, Doc.
Thank you,
Thank you,
Doc.
Doc.
Welcome. Okay.
Doc, thank you. Thank you very much.
Thank you as well.
Thank you.
Doc. Thank you po.
Thank you,
Thank you,
Doc.
Doc.
Happy dinner,
Thank you,
Doc.
Doc.
Merry Christmas.
We are not affected there. We have a very good weather here in Cebu.
Happy New Year.
Thank you, Doc. Bye-bye, Doc.
Thank you, Doc.
Welcome.
Thank you, Doc.
Welcome. Bye-bye.
Bye, Doc.
Bye, Doc.
Bye.
Bye, Doc.
Bye, Doc.
Bye-bye.
Bye-bye.
Merry Christmas, Doc.
Oh, it's Christmas na. Beer naman.
Happy Halloween, Doc.
Oh, November naman. Okay, December is just follows.
Bye, Doc.
Bye-bye.
Regards ko kay Julius, Doc.